to our board of directors, our corporate sponsors, to our program committee and all of the program committee faculty, and most importantly, to the patients and families that we serve, along with all of the healthcare personnel who take care of our patients. This talk is about you. If you're listening to this talk, you must be someone who spends a lot of their time thinking about kidney disease. You spend most of your days, many days and weekends, nights, even holidays, thinking about kidney disease, taking care of difficult patients with kidney disease, researching kidney disease, and advocating for a very vulnerable patient population. And your efforts, the fact that you've been leaning in, has made a huge impact on the nephrology community. And we've had an incredible year. In July of 2019, the Advancing American Kidney Health Initiative presidential order was signed. And with one stroke of a pen, our highest priorities were actually made into public policy and national directives. And 2020 was going to be our year, the year that we increase awareness of kidney disease, the year that we put kidney disease in the minds of many more Americans. And we put kidney disease in the minds of primary providers in order to prevent kidney disease, detect it earlier, and prevent end-stage renal disease. And we had incredible traction because of the Advancing American Kidney Health presidential order. But our traction has been interrupted by a global pandemic that has hit our society with such force never seen in our history. And at this time, it is incredibly critical at this historical time that you fully understand and you fully embrace the impact that you can and will have on patients' lives and their well-being and their safety, as well as the well-being and safety of yourself and your family. It is critical that you think of yourself as a giant, that the kidney community awakens the giant within. The COVID-19 epidemic is very unique. It's unlike any other battle or tragedy that any of us have ever experienced, because it affects every single one of us, regardless of age or race or socioeconomic status. It affects all of us. Millions are now out of a job. Thousands of people have been hospitalized. And as of this morning, over 1,000 people in the US have died of COVID-19. Our patient population is the population that is most vulnerable to COVID-19 with bad outcomes. And now the most basic activities that our patients do, like going to the grocery store, visiting with family and friends, or going to a dialysis unit, is really, really scary. And we know that almost half of all the infections in the US, unique to other countries, are actually occurring among people over the age of 50 and they're being hospitalized. In other words, the bad outcomes associated with COVID-19 within the US do not appear to be solely limited to the elderly or people with comorbid conditions. And healthcare workers who are on the front line are most at risk, and many lack the needed patient protective equipment, which makes them at highest risk. At no other time over the past century has it ever had more risk to be a healthcare worker. Over the next several weeks, it's likely that the number of COVID-19 cases will continue to increase before we see a plateau. Even if we strongly enforce social distancing, we quarantine those infected, and we quarantine those who are exposed, it's going to take a long time to get past this epidemic. And this epidemic has completely disrupted how we manage our chronic diseases. In the past, most of us spent majority of our time addressing chronic diseases, but now elective surgeries are completely canceled. All of the outpatient visits are canceled, and we're managing chronic diseases as an outpatient by telephone alone. And all of this has occurred. The changes have occurred so rapidly within weeks rather than months or years, which normally gives us time to prepare. So it's incredibly important that we think of ourselves as giants, because we are. We're a community of giants. We're advocates and providers who are not afraid to disrupt the status quo. We're not afraid to take big steps. We are a community that, no matter if a global epidemic that has hit every single continent in the entire planet except for Antarctica, is going to keep us from fighting for our patients with kidney disease and continuing the battle to improve the lives of all patients who are suffering with kidney disease. I use the word giant because giants are very tall in stature, and they can see past their obstacles. And because they can see past their obstacles, they're not afraid to take big steps. And when they take big steps, they're also not so concerned about stepping on other people's toes, as long as the big steps they are taking are the right ones. They also are very tall in stature, and they're able to elevate others. They're able to see higher and encourage others to see farther and think taller. And our history is really built on the shoulders of giants. And let me just tell you a story of Wilhelm Kolff. Dr. Kolff was the youngest and unpaid assistant at Groningen University in the late 1930s. And he had a patient who was 20 years old who died of kidney failure. After that 20-year-old man died, he knew that if he had just had an ability to lower urea, he would have been able to save that young man. And so he thought about it, and he went and took some sausage casing. He filled it with blood that had urea in it. And then he took that sausage casing with urea and put it into a bath of saline. Within 5 minutes, all of the urea that was in that blood had diffused across the sausage casing into the saline. And the concept of dialysis was born. But Dr. Kolff's life was extremely disrupted by World War II. The Netherlands was invaded by the Nazis, and the Groningen University was taken over by the Nazis. And all of his Jewish colleagues were ejected, and this infuriated him. So he left a university setting and went to a small hospital in Kampen. And at that hospital, he had no research funding. He had no support, but he never left that dialysis machine thought away. He used parts from downed airplanes. He used parts from washing machines. He used an old tin drum, and he used sausage casing to create this dialysis machine. But then he was in The Hague, which is a city not too far away from the Kampen, at the time that it was bombarded, heavily bombarded, and it caused massive casualties. But he was the one who took charge to create the very first blood bank in order to save lives. Now, he also never gave up on that dialysis machine, even when it failed over and over and over. In other words, he dialyzed not 1, 2, 3 patients that died, but 16 people that dialysis machine failed. But the 17th patient was Sophia. Sophia survived kidney injury because of his dialysis machine, and she lived another 7 years. And Dr. Kolff was also part of the Dutch resistance. He went and hid patients in his own home, risking the life of himself and his wife. And he hid patients in the hospital, pretended that they were sick and that he was their physician. And because of his actions, over 800 Jews and dissidents were kept from being put in concentration camps and murdered. After World War II, he took his dialysis machine plans to the United States, and he gave them to George Thorne at the Peter Bent Brigham Hospital, who then further developed the machine with the transplant group, which led to the very first transplant center in the United States. He never asked for a patent for any of his inventions, including the dialysis machine, because he wanted to make sure it was available for all patients. Another person who took big steps, but she probably never thought of herself as a giant, was Ada de Bode. Ada had a young son who was stricken with nephrosis, And at that time, they had no cure. So just a couple months after he was diagnosed, they created the Nephrosis Research Foundation in order to find a cure for her son. Now, they did not find a cure for her son in time, and he died at the age of 4. But she persisted, and they ended up finding a cure that did cure many other children who had this disease. And her research foundation became the National Kidney Foundation in 1964. And in the 1960s, the National Kidney Foundation got federal grants from the government to develop education programs across the country to teach people how to do dialysis. Because remember, in the 1950s, after World War II, Kolff had brought over this dialysis machine that was further developed at the Peter Bent Brigham Hospital. So dialysis was then blooming, but it was because of that National Kidney Foundation that she started that they taught people how to do dialysis, and dialysis spread throughout the country. And the seminal event of that early National Kidney Foundation then was the signing of the Social Security Amendment Act in 1972 by Richard Nixon, which then allowed dialysis to be used for patients across the country, no matter what their socioeconomic status was, no matter what their level was in society. And she probably never would have imagined then what happened further as the National Kidney Foundation continued moving on. In fact, the very first guideline to promote optimal care for patients with dialysis was done by the National Kidney Foundation. And over the next 20 years, many other guidelines have been created that went for all aspects of chronic kidney disease. And while many other societies have created guidelines, know that the National Kidney Foundation was the first. In addition, the National Kidney Foundation produces many patient education materials, and of course they do meetings like this to educate providers about the most latest and greatest research in kidney disease. And the National Kidney Foundation has screening events, they have advocacy events, they have fundraisers across the entire United States. She probably never dreamed that the National Kidney Foundation would have such a domino effect on the nephrology community. And something that is really prescient is the fact that about 2 years ago, the National Kidney Foundation did a home dialysis conference. And they brought together patients and providers to discuss how can we get more people to dialyze at home. Given the COVID-19 epidemic, it was completely prescient. In addition, the National Kidney Foundation had a consensus conference to try to figure out how we can use more of the kidneys that are discarded. Again, trying to promote transplantation. But both of those conferences, in addition to policy efforts that were going on without anyone really bragging about it by the National Kidney Foundation, had tremendous impact. This is Dr. Michael Choi, who is the past president of the National Kidney Foundation. Over here is Tanya Saffer, who is a former NKF policy staffer. This is Secretary Azar, and this is Adam Bowler, who is the former director of the Center for Medicare and Medicaid Innovation. And then all of this led up to the Advancing American Kidney Health Presidential Order in 2019. The presidential order had 3 major things. Number 1, to decrease the number of people who are developing end-stage renal disease. And number 2, to increase the number of people to get home dialysis or get a transplant. And number 3 was to double the number of kidneys available for transplant. And let me just talk to you about a new and really exciting initiative that will be, much more information will be given by Dr. Leslie Inker tomorrow. And of course, her session will be recorded. But for those of you who are interested in doing any form of research on kidney disease, please take note of the Patient Network. It's a national registry of adult patients with all stages of kidney disease. It's a non-interventional, web-based, retrospective, and prospective longitudinal initiative. Subjects will be enrolled by wide recruitment methods directed to the general market and closed systems, such as health networks or medical centers. Patient onboarding will consist of the submission of a signed e-consent, followed by creation of a unique identifier. And then the registry will link patient-centered data on the health history and outcomes and preferences with clinical and laboratory data obtained from the electronic health records. Data will be entered or uploaded in the web-based NKF patient network platform. And then data will be available to both patients and the scientific community to complete studies which aim at improving the knowledge and treatment of kidney disease. And the goal is to roll 50,000 people with kidney disease into the patient network. Now, as part of the Advancing American Kidney Health Presidential Order, and in partnership with CVS Health, the Department of Health and Human Services, and with American Society of Nephrology, a couple of weeks ago, the NKF launched the Are You the 33% campaign. And while it enjoyed early success, due to the COVID-19 pandemic, it was halted. But there's some really great statistics to show that this is going to be successful when it's relaunched. On World Kidney Day, 3,000 people took the quiz. And to date, almost 14,000 people have taken the quiz. Generally, media impressions range from about 12 to 20 million, but this time media impressions were 138 million. But in order to be sensitive to the COVID-19 epidemic, the National Kidney Foundation removed any social media posts that had anything to do with crowds or telling people to go to their primary care doctor. So the plans are to relaunch this campaign in September in conjunction with the National Hispanic Heritage Month. And we would like to say thank you to our corporate partners who helped make this campaign possible. CVS Kidney Care, AstraZeneca, Otsuka, Tricida, Health.io, and LabCorp. So you can see that over the past year, we took big leaps and we got really, really big traction. And you can look at this painting, and maybe you've seen this before, and we usually use it to describe it when people are standing on the shoulders of our mentors, on the people who've gone before us, like Ada DeBold and Willem Kalf. They are our giants in nephrology, and we stand on their shoulders. Because of the work that they did, we stand taller. The nephrology community stands taller. But I ask you to look at this differently. I ask you to see yourself as the giant and to see the future of nephrology standing on your shoulders. The future social worker, the future dietitians, the future nurses and nephrologists, the future researchers, the future advocates, and the future patients. Because we have big problems that we need to address immediately and moving forward. For example, 80% of our patients on dialysis still get dialysis in center, in these center units that are often in storefronts. And now with the COVID-19, you can see how critical it is for us to try to get more patients at home. And while thousands of patients have been transitioned from in-center units to home dialysis over the past year, it's still not enough. For those people who want to stay in in-center dialysis units, then it's imperative that we make sure that they are protected and they get the care that they need. And if they get COVID-19 infections, they're still able to get dialysis. But at the same time, we protect other patients from getting infected, and we protect our healthcare workers. It's a critical issue. The other issue has to do with transplantation, because that is our ultimate way of treating kidney failure. And kidney transplantation remains a waiting game. There's over 100,000 people who are waiting for a kidney transplant. And every single month, 3,000 people are added to that transplant wait list. And every day, many people die waiting for a kidney transplant. Many of the organs that are procured that potentially could be transplanted into patients are discarded. And we lack reasons for why these kidneys are discarded. And another issue is that there's huge silos of care, which in my opinion have worsened over time. We have the transplant team, we have the treating the general nephrologist, and then we have the patients. And these silos are not talking to each other. How can we determine the optimal kidney to transplant a patient if we're all not communicating together? In December of 2019, the National Kidney Foundation convened a group of experts to ask them, what can we do to maximize transplantation in the United States? And they had many ideas, but there was one idea that kept coming up over and over, and that had to do with chains, kidney donation chains. That's when you have a patient who needs a kidney, they have a donor, but that donor cannot donate to that particular patient because they're incompatible. But they would be willing to donate to another patient who's in a similar situation. But the problem is that these donor chains require a lot of organizational structure. They have complex consent forms and protocols, and it's not routinely available across the United States. We really need to make sure that these type of kidney chains, which can create miracles in certain areas, not be limited to major transplant centers, and there should be access to donor chains throughout the United States. The other issue has to do with the cost of immunosuppressions. So we know that immunosuppressive medications are only paid for by Medicare for the first 3 years. And we also know that many of our patients ration them after those 3 years, which leads to earlier graft loss and then need for a second and third kidney transplant, which just means another person is going back in that waiting list. A recent Budget Affairs analysis showed that if Medicare covered immunosuppressive medications, they would actually save $300 million over 10 years. I don't understand, if you're gonna pay for a transplant, you need to also pay for the immunosuppressive medications that maintain that kidney transplant. It's gonna be cost savings. And another major issue that continues to be the thorn in our side is the fact that most patients with kidney disease are not aware of it. If they're not aware, how can they maximize self-management? If they're not aware, how can they be getting the education they need, the medical nutrition therapy they need, or the medications that they need? And then this just leads to the fact that if they're not aware, they're not getting interventions, and they're more likely to end up on dialysis. And then when they end up on dialysis, they're not prepared. And that's just reflected by the fact that 80% of patients who start dialysis are starting with a catheter. It's just all part of the same problem. And then all of this leads to huge costs, which every year continue to escalate. Now we're at $120 billion per year for treating all stages of kidney disease, both CKD and end-stage renal disease. It's now 34% of the Medicare budget. It's just not sustainable. And the last thing is our major roadblock is lack of research funding, which has been ongoing for decades. And I want to say that the National Institute of Health has done a phenomenal job investing in cardiovascular disease for many, many years. And it has really paid off at the population level. In fact, over the past 50 years, cardiovascular mortality has declined by 80%. And I would say a huge chunk of that has to do with the research investment that the US made in cardiovascular disease. And research investment in cancer has saved 2.6 million lives since 1991. Yet kidney disease remains very poorly funded. In fact, cancer research is about 10-fold more than it is for kidney disease. And we know that about 34 million people with diabetes estimated now in 2020, and there's 37 million people with kidney disease. Yet research funding is almost 2-fold higher for diabetes than what it is for kidney disease. And this all leads to low levels of research for kidney disease, which has been going on for decade after decade after decade. So nephrology is the lowest bar here. All other medical specialties do more research and have more research funding basically than us. And then what that leads to is that we are not experiencing the benefits of decreasing mortality and improving survival for our patients as compared to patients with cancer and cardiovascular disease. There's a huge inequity here. The last thing about low research funding is that it's really having an impact on our ability to recruit people to do nephrology research. And at some point in time, people doing research in nephrology, they're going to be an endangered species unless this lack of funding is addressed and addressed quickly. So I end here, and I end with this picture again of the giant, because you are the giant, and the future of nephrology lies on top of your shoulder. There are complex acute problems that we are going to struggle with, but we're all in this together. We're truly a community of giants.
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 To me, the phrase standing on the shoulder of giants reflects the fact that medicine builds upon its past, upon our history.
Standing on the shoulder of giants means that we can achieve big things by standing on the people who've done big things that came before us.
There's no way that we would have gotten to this point with so much focus on kidney health as we have right here and now without standing on the shoulders of giants like the National Kidney Foundation.
The National Kidney Foundation is affecting change really through the Advancing American Kidney Health Initiative that is the culmination of years of NKF policy work.
Two components of the initiative are to improve utilization of home dialysis and to increase transplantation.
It's created a framework that allows the healthcare industry, the federal government, to prioritize kidney disease, to advance research, to advance innovation, to advance best practices, to increase quality initiatives, to increase spending, and really have a platform that allows patients to advocate on their behalf in a much more effective way.
The success of moving anything forward is going to demand that the patient's voice be involved. That's really where the National Kidney Foundation, I think, stands as a leader. And no other organization can do that in the kidney space.
The Kidney Patient Summit is an excellent opportunity for patients to get together, to network, to create energy, get on the hill, and really tell our stories.
Research right now is done on patients with kidney disease. We want research to be done on people with kidney disease. The National Kidney Foundation is establishing the first patient network for patients with chronic kidney disease. We hope that everybody with kidney disease looks to the patient network as the place to go to learn about kidney disease, to participate with kidney disease research, and to talk to other people.
The National Kidney Foundation has done a lot of tremendous things to try and promote particularly living donation. Their program, The Big Ask, The Big Give, has been a real win in trying to expose patients and programs to opportunities to help identify living donors.
The National Kidney Foundation has led the way in many respects in terms of identification of kidney disease, improving the care of patients with kidney disease. They have been a giant in the care of kidney disease patients for decades.
We are standing on the shoulders of giants, and now it's our time to leave a legacy. It's our time to go from helping thousands of patients to actually helping millions of patients, to really identifying and recognizing that kidney disease is a public health crisis and working rapidly to address that crisis. That's our opportunity, that's our legacy.
So I end here, and I just want to say thank you for everything you do to fight kidney disease. And thank you for everything you're going to do to fight kidney disease. Thank you so much for being kidney giants. I hope you enjoy the rest of the meeting.